How do you customize the plan based on somebody's health? What are some questions? What are some things? Because a lot of times when I hear her on the phone or we're reviewing calls, everybody, we love all of our clients. We love everybody that we get to talk to in this business. A lot of times they think it's a lot worse than what it really is. They think, oh, I take two medications. I'm doing this, I'm doing that. But how do you break it down for them to say, oh, okay, every day we're talking to people like this. We're like the mechanic at the shop. You bring your car in. Well, it's my car. Well, it's my body. Well, it's mine. It's mine. It's mine. It's important to you. And we understand that. So, how do you base that and help people with things like, I'm healthy, but I want traditional. I don't want to base it off my income. How would you guide somebody through that process as we wrap up the show?
So I really ask, what's their health in the last 5 years? That's an underwriting question. So we go through a lot of those. And what medications are they currently taking? And how do they use their insurance? Like, for example, I had a super healthy guy who no medications, no real diagnosis, but has been to the ER for something common. He went 3 times in a year. So I had him on a decent plan, but when I learned that, oh, he wants that extra ER, like that's his first go to. He doesn't have a primary care. He's not going to use urgent care. He's going to go to the emergency room. So we had to put him in a plan that had extremely great emergency room coverage. So we put him into that, and it really about the same money difference because I mean, these plans are competing for your business and you just kind of dial one thing up, another thing turns down. So we got the coverage exactly for him, still at the price that he was expecting. And now he has a great peace of mind going to the ER that he's going to have the coverage he needs.